The test showed positive and all the symptoms are there. So why an early ultrasound scan? Is it really needed? Well, let us learn why it is. The purpose of an early pregnancy scan is to determine if the pregnancy is healthy, to make sure that it is developing in the uterus and not in the fallopian tubes, and if the state of the tiny baby and the sac around it is good. The early pregnancy scan is even more significant for those mothers who are unsure of their dates, have had some bleeding, pelvic pains, concerns, or have felt that their early pregnancy symptoms have disappeared when they should have been present. The heartbeat of the baby can be seen from the 6th week onwards. Therefore, the early pregnancy scan can be performed from 6 weeks, 0 days to 11 weeks and 6 days from the first day of your last menstrual period or LMP. If your menstrual cycle is longer than 28 days, it is advisable to wait until you are at least 8 weeks from your LMP to confirm the viability of the baby, as you may not be as far along as your dates suggest. The purposes of the scan are as follows. 1. To confirm the location of the pregnancy. During the scan, the doctor assesses the position and shape of the gestational sac. It is important to spot the sac within the uterus, as this excludes an ectopic pregnancy, that is, a pregnancy developing inside the fallopian tube. 2. To determine fetal viability, since unfortunately 10% to 20% of known pregnancies do end in miscarriage. The third objective of the early pregnancy scan is to measure the fetal heart rate. 4th, to provide accurate gestational dating by measuring the crown to rump length, that is, the length of the baby. This is especially useful for mothers who have irregular periods. The fifth objective of the early pregnancy scan is to establish the estimated due date or the EDD. The sixth is to determine the number of fetuses. 7th, to assess the ovaries and the uterus to make sure that they are normal. The doctor examines the uterus and ovaries for any pathology, such as ovarian cysts or fibroids. Any internal bleeding is also checked for. 2 things that an early pregnancy scan cannot establish are if there are chromosomal or anatomical abnormalities, or assess the final location of the placenta, as it is too early. To prepare, the pregnant woman is required to have an adequately full bladder. There is certainly no need to be uncomfortably full. We suggest that one should go about her normal daily routine, but just not empty the bladder half an hour before the scan. There is a chance that a transvaginal scan may be needed in order to get a clearer view. Some mothers prefer this method of scanning as the resolution of the image is better, improving the accuracy of the measurements and the clarity of pictures. Prior to the scan, one must rest well, wear loose clothing, and take a water bottle along. Taking a toilet seat disinfectant is a good idea, since one will need to use the hospital's bathroom to empty the bladder post the scan.